I chose this program because I want to go into healthcare eventually. I'll probably get my master's in physician's assistants, and so this kind of gives me the opportunity to see some insight about different professions in the field and practice my Spanish a little bit too.
There's a lot you can learn in the classroom, but this has been a great experience just to get out and get immersed in the culture where they only speak Spanish and just try that out.
18 de septiembre, que es la primera junta de gobierno donde actuamos de manera independiente.
So to see that we really do live in a global society is something that I think is a great opportunity for our students to have the experience of.
The purpose initially was for our Communication Sciences and Disorders track, the emphasis in bilingual speech-language pathology program. We wanted to have an opportunity for our bilingual students to get a chance to see what speech-language pathology is in other countries.
Well, it gave me a good perspective on, what speech pathology looks like in other places, how it's similar, how it's different. So I thought that was a very valuable thing to see.
Here, they are able to do just as many things and even more sometimes, and I think that's really interesting.
We also wanted to involve the whole college because we wanted them to see that the real world is an interdisciplinary world.
That's how you did it. That is how you did it.
We wanted them to learn about other disciplines in health sciences and to see how they communicate and how they work together.
I've learned a lot about interprofessional care and the importance, which is a movement we're trying to move towards in the United States, but that hasn't happened yet, and I think we could learn a lot from Chile based off their interprofessional healthcare.
And we talk about that and try to provide them those opportunities at TCU. But I think studying abroad and really having a course where they have to engage with the other disciplines is very, very important. I think having the experience of learning about kinesiology and learning about speech-language pathology and learning about social work, learning about some of those other disciplines. And so to have the opportunity to learn about that in another country and to really interact with their peers in a setting for 3 weeks is really a great experience for them.
Kind of just seeing how we can learn from them and how they can learn from us, and basically compare and contrast and use both of those understandings to make healthcare better.